A coloboma, from the Greek koloboma, meaning defect, is a hole in one of the structures of the eye, such as the iris, retina, choroid, or optic disc. The hole is present from birth, except for one case, where it developed within the first few months of the child's life, and can be caused when a gap called the choroid fissure, which is present during early stages of prenatal development, fails to close up completely before a child is born. The classical description in medical literature is of a keyhole-shaped defect. A coloboma can occur in one eye, unilateral, or both eyes, bilateral. Most cases of coloboma affect only the iris. People with coloboma may have no vision problems or may be blind, depending on severity. It affects less than 1 in every 10,000 births. Signs and symptoms. The effects a coloboma has on the vision can be mild or more severe depending on the size and location of the gap. If, for example, only a small part of the iris is missing, vision may be normal, whereas if a large part of the retina or optic nerve is missing, vision may be poor and a large part of the visual field may be missing. This is more likely to cause problems with mobility if the lower visual field is absent. Other conditions can be associated with a coloboma. Sometimes, the eye may be reduced in size, a condition called microphthalmia. Glaucoma, nystagmus, scotoma, or strabismus may also occur. Causes. Colobomas can be associated with a mutation in the PAX2 gene. Eye abnormalities have been shown to occur in over 90% of children with fetal alcohol syndrome. Related conditions. Other ocular malformations that include coloboma or are related to it. Charge syndrome, a term that came into use as an acronym for the set of unusual congenital features seen in a number of newborn children. The letters stand for coloboma of the eye, heart defects, atresia of the nasal choanae, retardation of growth and/or development, genital and/or urinary abnormalities, and ear abnormalities and deafness. Although these features are no longer used in making a diagnosis, the name has remained. Cat eye syndrome, caused by the short arm, P, and a small section of the long arm, Q, of human chromosome 22 being present 3, trisomic, or 4 times, tetrasomic, instead of the usual 2 times. The term cat eye was coined because of the particular appearance of the vertical colobomas in the eyes of some patients. Patau syndrome, trisomy 13, a chromosomal abnormality that can cause a number of deformities, some of which include structural eye defects, including microphthalmia, Peters anomaly, cataract, iris, and/or fundus coloboma, retinal dysplasia or retinal detachment, sensory nystagmus, cortical visual loss, and optic nerve hypoplasia. Treacher-Collins syndrome, autosomal dominant syndrome caused by mutation of TCOF1. Coloboma is part of a set of characteristic facies that features craniofacial malformations, such as down-slanting eyes, ear anomalies, or hypoplasia of zygomatic bone and jaw, micrognathia. Diagnosis. Typically a coloboma appears oval or comet-shaped with round end towards the center. There may be a few vessels, retinal or choroidal, at the edges. The surface may have irregular depression. Treatment. Colobomas of the iris may be treated in a number of ways. A simple cosmetic solution is a specialized cosmetic contact lens with an artificial pupil aperture. Surgical repair of the iris defect is also possible. Surgeons can close the defect by stitching in some cases. More recently, artificial iris prosthetic devices such as the Human Optics artificial iris have been used successfully by specialist surgeons. This device cannot be used if the natural lens is in place and is not suitable for children. Suture repair is a better option where the lens is still present. Vision can be improved with glasses, contact lenses, or even laser eye surgery, but may be limited if the retina is affected or there is amblyopia. Epidemiology. The number of cases is around 0.5 to 0.7 per 10,000 births, making it a relatively rare condition. Notable cases. Notable people with coloboma include the late actor John Ritter, New York Times columnist Andrew Ross Sorkin, tennis player Arnaud Clement, alternative rock singer-songwriter Lachi, George Soros, and Madeleine McCann. McCann, a British girl, disappeared from the holiday apartment rented by her parents in May 2007 just before her 4th birthday. Posters and online campaigns promoting the search for Madeleine use the word look, with the first O in the word being drawn in the shape of a coloboma radius extending from the pupil at the 7 o'clock position.
Please subscribe and thanks for watching.